The Ministry of Health, through its expanded program on immunization and the National Nutrition Agency, with support from its partners, on Tuesday commenced a 6-day nationwide measles and rubella immunization campaign. The campaign will be integrated with other children's survivors services like vitamin A supplementation, deworming, and routine immunization services. The following services will be provided to children: measles and rubella vaccines for 9 to 59 months old children, vitamin A supplementation for 6 to 59 months old children, deworming tablets for 12 to 59 months old children. Speaking to journalist Mbanjai, Deputy Program Manager EPI, says the COVID-19 pandemic has affected their immunization coverage.
You know that like the COVID pandemic has definitely affected our immunization coverage. We have seen about 5% drop in our coverage when compared to 2019. So this as a result of the COVID. We're trying to make sure that like we catch up with our immunization coverage. That's why we are also adding the routine vaccines for those children that definitely defaulted their antigens.
He further explains the reason for the campaign.
The reason why we are doing the campaign is children would definitely miss their vaccinations, and then also some also would be vaccinated but do not seroconvert. Some would not get their second dose of vaccine, because the measles vaccine is a vaccine that we give every clinic to children, and then they usually giving it at the age of 9 months. And also a second dose is given at the age of 18 months. But some children would not do not come to get those because of one reason or the other. That's why we making sure that like we go close to the population and then increase the immunity of children to make sure that like they are all vaccinated to protect ourselves against and our population against measles.
Modunjai, Director of Health Promotion and Education, assures the population that the vaccines are safe and effective.
So we want to assure the entire population that the vaccine we are giving, it is very safe and effective, and it's also to protect them against measles and as well as rubella, and also protect them also against vitamin A deficiency, and also protect them also addressing the issues of the worm infestation. So therefore, if it is an integrated approach, the ministry felt it with its partners to provide such a very important event, which is starting today. And we want to tell each and every household head, be it a female household head or a male household head, to ensure that all the children that fall within this age category of 9 months to 59 months, and as well as 6 to 59 months, to ensure that all these children are available at the Bantabas. We are not doing house to house this time. We want to, because some of the parents might be waiting for us in their houses, but we are not going to be in the houses. Instead, we are going to be in the Bantabas, in the schools, in the markets, and then garages, and so on. So
Jai appeals to mothers and caregivers to take children for vaccination, which would help them to get their coverage.
So wherever there are the teams, people see teams gathered, let them make sure that their children are taken there. And that will really help us again to make sure that all the children in that particular community are covered. But let them not also wait until teams are about to depart and say, oh, well, I want my child to be vaccinated. As long as they see the teams in their communities, let them come out. No matter how long the queue may be, let them make sure that their children benefit from this vaccination program. As Njai rightly mentioned, we are still reporting cases of measles in this country, and we don't want to see it. And then the only way we can be able to protect our children is to make sure that they are vaccinated. And in this country, we have been vaccinating our children, including myself, since 1970s, in the 1978 to 1979. So obviously, Gambians are very much used to our vaccination programs. We have done a series of pilots with regards to certain vaccines that have been used in this country, and they've been piloted in our own country, and then it's also been given to our children, and we have no issues. So Gambians are very much used to vaccination, and Gambians have been very much supportive to the health sector in terms of vaccination campaigns, and as well as even routine immunization. So we want to appeal to the entire population, appealing to the caregivers and mothers, and to make sure that their children are taken to the vaccination centers wherever the teams are. So this will really help us to get our coverage.
The campaign will target Bantaba approach, meaning community centers, schools, mosques, churches, ferry crossing points, markets, and strategic locations where children can be accessible for vaccination. Reporting for Kerr Fatou, I am Ramatulai Jao.